What is high blood pressure? Blood pressure is the force at which blood pumps from the heart into the arteries. A normal blood pressure reading is less than 1/120th of a millimeter Hg. When blood pressure is high, the blood moves through the arteries more forcefully. This puts increased pressure on the delicate tissues in the arteries and damages the blood vessels. High blood pressure, or hypertension, affects about half of American adults, estimates the American College of Cardiology. Known as a silent killer, it usually doesn't cause symptoms until there's significant damage done to the heart. Without visible symptoms, most people are unaware that they have high blood pressure. Understanding high blood pressure. According to the American Heart Association, nearly half of American adults now have blood pressure levels that would be described as high. A number of factors contribute to elevated blood pressure, such as genetics, stress, diet, smoking. Lack of exercise. Because it's largely symptomless, hypertension is known as the silent killer. This is why it's so important to have your blood pressure checked regularly. Having high blood pressure increases your risk of several health problems, such as heart attack, stroke, diabetes, heart failure, kidney disease, vision loss, metabolic syndrome. There are a number of things you can do to lower your blood pressure naturally, even without medication. Number 1. Walk and exercise regularly. Exercising 30 to 60 minutes a day is an important part of healthy living. Along with helping lower blood pressure, regular physical activity benefits your mood, strength, and balance. It decreases your risk of diabetes and other types of heart disease. If you've been inactive for a while, talk to your doctor about a safe exercise routine. Start out slowly, then gradually pick up the pace and frequency of your workouts. Not a fan of the gym? Take your workout outside. Go for a hike, jog, or swim and still reap the benefits. The important thing is to get moving. The American Heart Association (AHA) also recommends incorporating muscle strengthening activity at least 2 days per week. You can try lifting weights, doing push-ups, or performing any other exercise that helps build lean muscle mass. Number 2. Eat more potassium and less sodium. Increasing your potassium intake and cutting back on salt can also lower your blood pressure. Potassium is a double winner. It lessens the effects of salt in your system, and also eases tension in your blood vessels. However, diets rich in potassium may be harmful to individuals with kidney disease, so talk to your doctor before increasing your potassium intake. It's easy to eat more potassium, so many foods are naturally high in potassium. Here are a few. Low-fat dairy foods, such as milk and yogurt, fish, fruits, such as bananas, apricots, avocados, and oranges, vegetables, such as sweet potatoes, tomatoes, greens, and spinach. Note that individuals respond to salt differently. Some people are salt-sensitive, meaning that a higher salt intake increases their blood pressure. Others are salt-insensitive. They can have a high salt intake and excrete it in their urine without raising their blood pressure. The National Institutes of Health (NIH) recommends reducing salt intake using the DASH dietary approaches to stop hypertension diet. The DASH diet emphasizes low-sodium foods, fruits and vegetables, low-fat dairy, whole grains, fish, poultry, beans, fewer sweets and red meats. Number 3. Drink less alcohol. Drinking alcohol can raise blood pressure. In fact, alcohol is linked to 16% of high blood pressure cases around the world. While some research has suggested that low to moderate amounts of alcohol may protect the heart, those benefits may be offset by negative effects. In the U.S., moderate alcohol consumption is defined as no more than 1 drink a day for women and 2 for men. If you drink more than that, cut back. Number 4. Stop smoking. Stopping smoking is good for your all-around health. Smoking causes an immediate but temporary increase in your blood pressure and an increase in your heart rate. In the long term, the chemicals in tobacco can increase your blood pressure by damaging your blood vessel walls, causing inflammation, and narrowing your arteries. The hardened arteries cause higher blood pressure. The chemicals in tobacco can affect your blood vessels even if you're around secondhand smoke. A study showed that children around secondhand smoke in the home had higher blood pressure than those from non-smoking homes. Number 5. Eat less processed food. Most of the extra salt in your diet comes from processed foods and foods from restaurants, not your salt shaker at home. Popular high-salt items include deli meats, canned soup, pizza, chips, and other processed snacks. Foods labeled low-fat are usually high in salt and sugar to compensate for the loss of fat. Fat is what gives food taste and makes you feel full. Cutting down on, or even better, cutting out, processed food will help you eat less salt, less sugar, and fewer refined carbohydrates. All of this can result in lower blood pressure. Make it a practice to check labels. According to the U.S. Food and Drug Administration (FDA), a sodium listing of 5% or less on a food label is considered low, while 20% or more is considered high. Number 6. Cut back on caffeine. If you've ever downed a cup of coffee before you've had your blood pressure taken, you'll know that caffeine causes an instant boost. However, there's not a lot of evidence to suggest that drinking caffeine regularly can cause a lasting increase. In fact, people who drink caffeinated coffee and tea tend to have a lower risk of heart disease, including high blood pressure, than those who don't. Caffeine may have a stronger effect on people who don't consume it regularly. If you suspect you're caffeine sensitive, cut back to see if it lowers your blood pressure. Number 7. Reduce excess stress. We live in stressful times. Workplace and family demands, national and international politics, they all contribute to stress. Finding ways to reduce your own stress is important for your health and your blood pressure. There are lots of different ways to successfully relieve stress, so find what works for you. Practice deep breathing, take a walk, read a book, or watch a comedy. Listening to music daily has also been shown to reduce systolic blood pressure. A recent 20-year study showed that regular sauna use reduced death from heart-related events. And one small study has shown that acupuncture can lower both systolic and diastolic blood pressure. Number 8. Try meditation or yoga. Mindfulness and meditation, including transcendental meditation, have long been used, and studied, as methods to reduce stress. A 2012 study notes that one university program in Massachusetts has had more than 19,000 people participate in a meditation and mindfulness program to reduce stress. Yoga, which commonly involves breathing control, posture, and meditation techniques, can also be effective in reducing stress and blood pressure. A 2013 review on yoga and blood pressure found an average blood pressure decrease of 3.62 mm Hg diastolic and 4.17 mm Hg systolic when compared to those who didn't exercise. Studies of yoga practices that included breath control, postures, and meditation were nearly twice as effective as yoga practices that didn't include all three of these elements. Number 9. Eat dark chocolate or cocoa. Here's a piece of advice you can really get behind. While eating massive amounts of chocolate probably won't help your heart, small amounts may. That's because dark chocolate and cocoa powder are rich in flavonoids, plant compounds that cause blood vessels to dilate. A review of studies found that flavonoid-rich cocoa improved several markers of heart health over the short term, including lowering blood pressure. For the strongest effects, use non-alkalized cocoa powder, which is especially high in flavonoids and has no added sugars. Number 10. Lose weight. If you're overweight, losing weight can make a big difference for your heart health. According to a 2016 study, losing 5% of your body mass could significantly lower high blood pressure. In previous studies, losing 17 pounds (7.7 kilograms) was linked to lowering systolic blood pressure by 8.5 mm Hg and diastolic blood pressure by 6.5 mm Hg. To put that in perspective, a healthy reading should be less than 1/120th of a millimeter Hg. The effect is even greater when weight loss is paired with exercise. Losing weight can help your blood vessels do a better job of expanding and contracting, making it easier for the left ventricle of the heart to pump blood. Number 11. Try these medicinal herbs. Herbal medicines have long been used in many cultures to treat a variety of ailments. Some herbs have even been shown to possibly lower blood pressure. Although, more research is needed to identify the doses and components in the herbs that are most useful. Always check with your doctor or pharmacist before taking herbal supplements. They may interfere with your prescription medications. Here's a partial list of plants and herbs that are used by cultures throughout the world to lower blood pressure. Black bean, cat's claw, celery juice. Chinese hawthorn, ginger root. Giant dodder. Indian plantago, maritime pine bark, river lily, ricel, sesame oil, tomato extract, tea, especially green tea and oolong tea, umbrella tree bark. Number 12. Eat garlic or take garlic extract supplements. Fresh garlic or garlic extract are both widely used to lower blood pressure. According to one clinical study, a time-release garlic extract preparation may have a greater effect on blood pressure than regular garlic powder tablets. One 2012 review noted a study of 87 people with high blood pressure that found a diastolic reduction of 6 mm Hg and a systolic reduction of 12 mm Hg in those who consumed garlic, compared to people without any treatment. Number 13. Eat healthy high-protein foods. A long-term study concluded in 2014 found that people who ate more protein had a lower risk of high blood pressure. For those who ate an average of 100 grams of protein per day, there was a 40% lower risk of having high blood pressure than those on a low-protein diet. Those who also added regular fiber into their diet saw up to a 60% reduction of risk. However, a high-protein diet may not be for everyone. Those with kidney disease may need to use caution, so talk to your doctor. It's fairly easy to consume 100 grams of protein daily on most types of diets. High-protein foods include fish, such as salmon or canned tuna in water, eggs, poultry, such as chicken breast, beef. Beans and legumes, such as kidney beans and lentils, nuts or nut butter such as peanut butter, chickpeas, cheese, such as cheddar. A 3.5-ounce Oz serving of salmon can have as much as 22 grams g of protein, while a 3.5 ounces serving of chicken breast might contain 30 grams of protein. With regards to vegetarian options, a half-cup serving of most types of beans contains 7 to 10 grams of protein. 2 tablespoons of peanut butter would provide 8 grams. Number 14. Make sure to get good, restful sleep. Your blood pressure typically dips down when you're sleeping. If you don't sleep well, it can affect your blood pressure. People who experience sleep deprivation, especially those who are middle-aged, have an increased risk of high blood pressure. For some people, getting a good night's sleep isn't easy. There are many ways to help you get restful sleep. Try setting a regular sleep schedule, spend time relaxing at night, exercise during the day, avoid daytime naps, and make your bedroom comfortable. The National Sleep Heart Health Study found that regularly sleeping less than 7 hours a night and more than 9 hours a night was associated with an increased prevalence of hypertension. Regularly sleeping less than 5 hours a night was linked to a significant risk of hypertension long term. Number 15. Take these BP-lowering supplements. These supplements are readily available and have demonstrated promise for lowering blood pressure. Omega-3 polyunsaturated fatty acid. Adding omega-3 polyunsaturated fatty acids or fish oil to your diet can have many benefits. A meta-analysis of fish oil and blood pressure found a mean blood pressure reduction in those with high blood pressure of 4.5 mm Hg systolic and 3.0 mm Hg diastolic. Whey protein. This protein complex derived from milk may have several health benefits, in addition to possibly lowering blood pressure. Magnesium. Magnesium deficiency is related to higher blood pressure. A meta-analysis found a small reduction in blood pressure with magnesium supplementation. Coenzyme Q10. In a few small studies, the antioxidant CoQ10 lowered systolic blood pressure by 17 mm Hg and diastolic up to 10 mm Hg. Citrulline. Oral L-citrulline is a precursor to L-arginine in the body, a building block of protein, which may lower blood pressure. If your blood pressure is very high or doesn't decrease after making these lifestyle changes, your doctor may recommend prescription drugs. They work and will improve your long-term outcome, especially if you have other risk factors. 44. Trusted source. However, it can take some time to find the right combination of medications. Talk with your doctor about possible medications and what might work best for you.